Right, good afternoon, everybody. Daily briefing with Paul and Josh, and backed by popular demand, Dr. Matt Carter, who you know is our state epidemiologist, give a broad overview, and he's brought Kristen Soto with him. Kristen is an expert on track and trace, and that's going to be the focus of our discussion here this afternoon. Let me just tee it up for just a couple of minutes. If you look at our daily summary, I think of most interest to me, I usually don't spend as much time on the positive cases because I tell you that's simply a function of how much testing we're doing. But we did a fair amount of testing, 2,000 tests performed, and only 315 positive cases. 315 is the lowest we've had in weeks, and that's about a 16% or so test rate. So we'll see if that indicates anything. But when I say only 315, I don't mean it. Tomorrow, we've got two folks who are going to come who were both afflicted with COVID, tested positive. You may know one is Rudy Marconi, first selectman of Ridgefield forever, and he'll be here to talk about his experience and as regards a ring town in Fairfield County, but his personal experience. And also Jane Garibay. She's a state representative, Chamber of Commerce, afflicted back in mid-March, quite a while ago, just to give a little personal perspective of what we talk about when we say positive cases. Again, you'll see hospitalization is down. That's, I think, what, the 6th day in a row. That's, of course, a trend line that we're following as regards our plans for a gradual reopening of what we're trying to do. And that's indicative of the fact that our hospitals have capacity. They're at about 2/3 capacity right now, and that's a good sign, and our ICUs even have more capacity. Current hospitalizations, the next slide, is pretty much the same trend as you've seen before. The good news is those lines at the bottom, Wyndham, Tottenham, New London, not going up as fast. Maybe social distancing is working there. And of course, our big curves are continuing to bend down now. Day-to-day change in hospitalizations, again, you look at that trend line. That's the trend line that gives us a green light when we think we can start thinking about reopening some of the sectors of the economy that are not open now. We're about a week into that, and within a week from now, we'll give you stronger indications. As you know, on Thursday, we've got the Reopen Committee here to answer any of your questions. I just want to say, as we get into the track and trace discussion, it's all about making sure that we contain this virus, making sure we slow the spread, and making sure that as we slowly get back to work, we do it on the safest way possible. And I'm reminded that we have a very high unemployment rate. 439,000 people have applied. That would imply an unemployment rate north of 20%, the likes of which we haven't seen since the Great Depression. This is not a permanent state. It's a short-term state. We're doing everything we can to rectify that, and that's why we're focused on some of the things we can do. I mean, obviously, the Department of Labor has put out $330 million in claims over the last month. And those $600 claims now, that true up from the federal government, have started being paid in the last few days. So I think that's going to inject some money into the economy, and that's going to inject some confidence into the economy. You know, as you know, we had 18,000 small businesses get accepted for the PPP loans. And as you've heard, the next round of those loans is being processed as we speak. And I hope Connecticut's small business continue to do very well. As you know, as we think about reopening more and more of our businesses, we've got some safe workplace rules. That includes wearing of the mask. And, you know, thanks to incredible generosity of a lot of people around the state, a lot of companies around the state, and Josh's ability to acquire, you know, masks and other PPE strategically, our stockpile is growing, for which we're very appreciative. As you know, you can go to the CBIA website, and I think we've had 5,400 small businesses with less than 50 people, who have come in and they've asked for a mask, you know, a couple of masks per employee, just so we can get these businesses going and doing that safely. But another key to being able to operate our lives safely is track and trace. And track and trace sounds a little like Big Brother, but Dr. Carter has reminded me that this is a tried and true method of limiting an infectious spread, and it goes back 100 years. And Kristen Soto has been doing this focused on measles, which I'm told is also highly infectious. So what we've done on measles over the last 10 years, I'm afraid we're doing with COVID by a factor of 20. It's ramping this up in a significant way. And we're going to tell you how we're working with our local departments of public health. We've got 15 of them lined up right now, and we've got volunteers. We hope to get, I think, hundreds of volunteers are already doing this, get another 500 volunteers in the near future. And what they'll be doing is finding out who has been infected. That's information. Give them a text or give them a call. Find out who they've been in contact with, say 10 minutes of contact within 5 or 6 feet apart from each other. And you, on a voluntary basis, give us that information so we can tell people you may have been exposed or in contact to COVID. And this has worked in years past with measles. This is what we're working on a regional basis with Governor Cuomo and the others. And we're beginning to roll that out now in a serious way, because that's the most effective thing we can do to reduce the spread, limit the spread, and get you back to work. And with that, I think I'd like to introduce Kristen Soto, who has been doing this for some years as our measles sheriff. And now you're heading over to what we can learn from measles and take that to COVID. Kristen?
Thank you, Governor. My name is Kristen Soto, and I'm an epidemiologist in the infectious disease section at the Connecticut Department of Public Health. Today, I'll be telling you a little bit more about contact tracing, which is one of the key tools in our public health toolbox to help control the spread of diseases, including COVID-19. We've been working closely in collaboration with the Reopen Connecticut team to make sure that what we're doing in terms of contact tracing aligns with strategies to help Connecticut return to normal. In particular, I'm really excited today to tell you about a new initiative called Contact. Contact is a system that we're developing in partnership with Microsoft and their ARIAS, or At-Risk Identification Alert System. And so us here at the Department of Public Health, as well as our 64 local health departments, will be working closely with Microsoft to implement this solution over the next month. Next slide, please. As the Governor and Dr. Carter have emphasized, contact tracing is not something that's new, and this is something that we routinely use for other infectious diseases, including including measles. We're looking to adapt the strategy for COVID in order to help stop the spread of infection in our communities and prevent small clusters or individual cases from turning into larger community outbreaks. So without contact tracing, people might spread COVID-19 unknowingly. I think it's important to point out that although people can choose to stay home if they're sick, oftentimes people might spread a disease either before they start to show symptoms or if they're asymptomatic. So even if somebody follows all of the public health recommendations, there is still a chance that they could unknowingly spread it to their close contacts, and those contacts in turn could spread it to others in the community. Contact tracing, on the other hand, helps us put in place control measures to stop exposures from happening. How this works in general terms is when we identify a positive case, we will speak with them to determine their potential exposures and who they've come into contact with, both immediately before they became sick, as well as once they started showing symptoms. We then ask those contacts to remain at home, therefore interrupting the chain of transmission and stopping the spread of COVID further in the community. Next slide, please. I would now like to talk to you a little bit more about the contact solution specifically and how we'll be using this technology to leverage our existing contact tracing plans to really have a coordinated statewide effort. Local health departments, as well as the Department of Public Health, will continue to receive information on all individuals in the states that test positive for COVID-19. This information is already being shared as part of our reportable conditions and is in a common database. We will be integrating this data with our contact tracing system in order to rapidly interview people who test positive for COVID. This work will be done by public health professionals who work either at the Department of Public Health, at one of our 64 local health departments, or with trained and credentialed volunteers from academic institutions, including schools of public health, schools of medicine, schools of nursing, and schools of social work. This workforce will allow us to quickly reach out to people, identify their exposures, and also give them guidance on what they can do to prevent spreading this infection to others around them. Additionally, by leveraging this new technological system Contact in partnership with Microsoft, we'll be able to rapidly share information across jurisdictions. So if a person resides in one jurisdiction and has contacts in another, that information can be seamlessly shared for follow-up. All cases will be asked to fill out a questionnaire letting us know about their symptoms, when they became sick, and who they may have exposed either immediately before or while they were symptomatic. This information will help us to identify individuals who are at risk of developing COVID and give them recommendations in terms to remain at home and stop the spread of COVID in the community. Again, all contact tracers that we're working with will be trained to provide support to individuals who are identified as both cases and contacts, being able to answer general questions about the disease, as well as referring individuals to social services as needed. And they will also have training to make sure that we're handling all health information in a confidential and secure manner. Next slide, please. I think it's important to point out that DPH as well as local health departments can only do so much, even with the best technology in the world. And that for contact tracing to really work, we need the support of you and the public to help us in this endeavor. First of all, if you test positive for COVID-19, you should know that somebody from a public health department, again, either DPH, your local health department, or a volunteer from an academic institution will be contacting you to talk about your illness. This contact might be occurring via text message, emailing, or over the phone. So again, we're asking that if you are either a case or if you're identified as a contact, if you do receive communication from the Department of Public Health or one of our public health partners, it is important to work with us, fill out the questionnaire, and let us know about your illnesses as well as potential exposures to really help protect those around you. If you are asked to do so, please self-isolate or self-quarantine. People who are not showing symptoms are capable of spreading COVID to others, so staying home when asked to do so really is the best way to prevent the spread of this infection in the community. We're currently in the early phases of this implementation. We officially kicked off development of the software today. We expect to have the contact system in hand for our use within the next week. And then we're going to do a week of training and pilot testing with 20 of our local health departments before rolling this out statewide, probably by the third week in May. So we will be keeping you posted with further announcements as we get further in this process. Thank you.
Really helpful and fast work. Appreciate that. And happy to take questions, and Dr. Carter is here as well.
We'll start with Hearst, Connecticut Media.
Let me get away from the TV. Sorry, Max. Hi, Governor. Do we have information on nursing home discharges and recoveries and things?
So for our COVID recovery centers, as of today, we're up to 158 residents admitted into 3 active recovery centers, and we've already had 5 discharges actually from Sharon, which was the first one live. Just today, actually, we've had 5 discharges, so some great news there.
Do we have any overall figures, Josh?
Well, we'll share the usual big data list of all the nursing homes with with Infections on Thursday, so 2 days from now, as we've been doing over the last couple of weeks. I could just provide one other quick update. As we've discussed the last couple of days, our team at Public Health, along with support from the National Guard and CDC, have been out visiting nursing homes and assisted living facilities as well, and they've now completed 216 visits by close of business today. So a lot of great progress getting out into the community, fanning off across the state, and helping support the teams doing such important work.
Thanks. Do we have a ballpark figure on the number of tracers who may be involved?
So currently we have approximately 300 individuals from PH as well as local health departments who are involved in this effort. We anticipate recruiting an additional 400 to 500 volunteers from our academic institutions. And we're really looking at a scaled approach, so we will be continuing to evaluate the need for additional volunteers or staff as the project progresses.
Could you repeat the first number? I'm sorry, I'm getting an echo.
Sorry, we currently have 300 contact tracers between DPH and our 64 local health departments. And then we anticipate recruiting 400 to 500 academic volunteers, and we'll continue to evaluate this strategy moving forward and see if additional volunteers or staffing are needed down the line to support this effort.
Thanks. And Dr. Carter, do you have any update on immunity of people who are coming out of the COVID infection?
Dr. Carter, you're muted.
Thank you, Max. As you probably have read, this is $1 million question. What we don't know is whether or not immunity will be long-lasting. We know that many people who recover from this infection will have immunity for months, maybe a bit longer, but we will not know until studies have been done if that's long-lasting immunity.
Move along next.
Thanks.
Move along next to WTIC 1080 News.
Dr. Carter, on the trace, how many people do we have to track and trace to be able to prevent further spread? What percentage of the population?
Yeah, I'd like to take that question. This is Dr. Carter. Essentially, contact tracing is really difficult to do when we're near the peak, which is where we are right now, where it's going to play a very important role. Right now, what we see is a flattening of the curve. And that flattening is occurring because of the community mitigation that we've done, the social distancing, staying at home. And that's what's driving the case numbers down, especially as you can see that in hospitalizations. What will be needed, this is really mid-May to late May. The numbers of cases will decrease. The number of tests being done will dramatically increase. And our goal is to do contact investigation of every confirmed case. And so we're not, we know that not everyone will want to participate in contact tracing, but our goal is to reach every case, to identify every contact, and ask them to participate in the contact tracing process, and to self-isolate or stay at home in self-quarantine.
Could I just point out to Max that we're getting a massive reverb on the audio? I don't know if there's a way to, but it's to the point where the audio is not going to be usable.
Any suggestions, Max?
Perhaps log out of the Microsoft Teams call and log back in. We'll move along next to the Waterbury Republican American.
Yes, I have another question for Dr. Carter. Perhaps you could give us your thoughts on the statistics that we've been seeing. It's been a while since we've heard from you. We've had another day of hospitalization declines. The governor pointed out at the start about the number of positive cases. So perhaps you could give us an assessment from an epidemiologist's point of view.
Of the call to log back in to attempt to fix an audio issue. If you have another question, you can direct to either Ms. Soto or the governor or Josh or Paul. I would start there.
Okay, well, yeah, all right. Well, with the governor, we've heard some more objections raised to the composition of this CT Reopen Advisory Board and its operations outside the Freedom of Information Act. Today from the House Minority Leader, the Conservative Caucus, the Yankee Institute for Public Policy. They say it's a matter of public confidence and trust that the people who will be most affected by the discussions that will inform its recommendations be able to hear them.
Well, I'll take that question, and then Dr. Carter, you can talk maybe a little bit about some of the trend lines you've seen since last you were here. Look, I'm making the call in terms of how fast we open, what we open, how we can do that safely, but I had to work really quickly in terms of getting the very best and the brightest I could from around the state to volunteer their time, working in many cases 16, 18-hour days, email, phone, whatever it may take, so we can get this going. They're going to be reporting and able to answer every question you've got on a Thursday, and I'm here every afternoon to do this as well. And that's why we've set it up as a purely advisory board, Paul, so we can get this going quickly. So I get track and trace going in less than a week. So we can start our reopening strategy 14 days after as the downcline from the hospitalizations. I don't want to slow this up in any way. I think it's too important. And so that's why we've set this up in the way we have, here to answer any questions you have, because I'm the person at the end of the day making the call, surrounded by some really smart people.
Thank you, Governor. Dr. Carter?
Could you repeat the question, please? And is my audio better?
Sounds good to me. No, I just wanted to hear your perspective on the trend lines that we've seen, the decrease in hospitalizations, yet another daily decrease. The governor spoke about the drop in daily tests today, positive tests. So we haven't heard from you in a while. So your thoughts on the trend lines?
I think it's clear that social mitigation, what we've done in terms of social distancing has had a dramatic effect on disease transmission. We certainly have seen a much slower spread of COVID-19 in the state of Connecticut than we thought we would see a month ago. I am concerned, however, that we need to, the trends are encouraging, but the number of cases that we still have are far too many, and we should not think that we are through this at this point in time. If you look at the number of hospitalizations that are continuing to happen, the number of deaths that are continuing to happen, the New York City, Connecticut, New Jersey, tri-state outbreak is still some of the largest COVID activity in the United States, and we still have a ways to go.
Chances for a second wave?
There is always a chance of a second wave. One of the things that we have learned about COVID-19 is that it's very unpredictable. And it's also clear that we are probably going to see an increase in COVID activity in the Southern Hemisphere, in Australia, South Africa, et cetera, places that are just now entering their winter season. So COVID is going to continue to exist even if our numbers go down here in the United States. And it is likely that we will see a second wave in the fall. We would all wish that that was not the case. But if we do have a second wave, I think we have time to prepare to make sure that we have enough personal protective equipment. We may have an antiviral treatment at that point in time, something that actually treat the infection, which would be a tremendous advance. We will not have a vaccine yet by the fall, but we will be in a better place. I don't think any of us would look forward to re-entering quarantine again the way we have, but it's something that we need to be prepared for.
We'll move along next to CT News Junkie.
Thanks, Max. This question is for the governor. Governor, why has the Department of Public Health decided not to mandate hospitals to allow the disability community to bring a patient support person with them to the hospital?
My understanding is we've done that. Isn't that right, Paul?
Yeah. Paul Mallon, Chief of Staff for the Governor. Christine, our agency, Commissioner Jordan Sheff, has worked with the Connecticut Hospital Association on various guidelines on this very matter that should be public either later today or tomorrow. But that leaves out
33,000 people in the state with disabilities.
Can you say that again, Christine?
It leaves out 33,000 people in the state with disabilities because it doesn't apply to anyone who doesn't receive services through DDS.
Well, I'll be happy to follow back up with you offline on that. But I know that Jordan Sheff, our commissioner, has been working vigorously on this issue with extreme compassion with the Hospital Association. Okay,
and Dr. Carter, what do we know about the nursing homes and the staff there and the air systems? Are they able to properly cohort patients with COVID?
Well, what's been happening with the teams that have been going out to the long-term care facilities is to look at the implementation of control measures at each of the places that they go to. One of the biggest issues is making sure that not only do the workers have enough PPE, personal protective equipment, but they know how to use that equipment. Cohorting is possible in many of the facilities. And at this point in time, we have seen a leveling off of cases in nursing homes, which is a part of the leveling off that we're seeing across the state as well. I think we're in a much better position now than we were a month ago when infections were occurring rapidly in long-term care facilities and the supply of PPE was very low and staffing was really an issue. Things have improved, although there is still a lot of work to do. Essentially, we need to make sure that infection control practices in these long-term care facilities are as perfect as we can make them, because clearly persons who live in these long-term care facilities and assisted living facilities are at high risk for serious illness, hospitalization, and death from COVID-19.
And Josh said that you guys have gone and inspected 216 nursing homes. Do we have any numbers as far as the assisted living facilities go? Do we have numbers on the positive cases and the deaths?
So the 216 includes both nursing homes and assisted living facilities. So that's 216 out of approximately 350 in total of both nursing homes and assisted living facilities. And as mentioned previously, we're tracking, Dr. Carter and his team are tracking to put together the data for the assisted living facilities this week as well.
Thank you.
Move along next to Channel 3 Eyewitness News.
Yes, Governor, going back to the contact tracing, there's going to be critics who are worried about big brothers and worried about their privacy. Can you tell us who's managing the data? Is it going to be the state local health departments, or is it going to be put in the hands of a private company like Microsoft?
Right now, all that information goes to the departments of public health and local places. People know who has been infected. We in turn will text or notice those people, and then they have an opportunity to opt in or say no. But we try and encourage them, if they care about the friends and people they've been in contact with, on a voluntary basis to let us know who those people might be. So there's nothing is mandatory about this process, but of course the more people that participate, the more effective it is.
And on the flip side of this, there's going to be people who are all about this contact tracing, mostly people who have not tested positive who want to know if they came in contact with someone who did. Is there something out there? Can they take part in this if they'd like to?
Did you follow that?
Let me take a stab at that one. This is Dr. Carter. Right now, our focus is on identifying people who've been sick and test positive for COVID-19. But as testing capacity ramps up during May, we'll increasingly be testing people who do not have any symptoms, because we know that people who don't have symptoms can transmit COVID. And so we'll be testing people who are asymptomatic. And those people will then be enrolled in the case investigation and the contact tracing as well. But I think you're also hinting at something else that many people may have read about, is that there are new technologies coming along. Many people have read about the Apple-Google solution, which involves Bluetooth. These are new technologies which may be available in May. And I think we'll have to see how those become layered on top of our existing system. Our system that we're using is the traditional contact tracing system, but these newer systems, like the Apple-Google proposal, will provide aggregate information to systems, but not that same level of information. So we need to figure out how people will choose which of these systems they decide to participate in.
Move along next to the Connecticut Mirror.
Good afternoon. A couple of questions on contact tracing. How low do the new caseloads have to fall before you can meet your goal of doing contact tracing on every new case?
Well, we're not going to wait until the numbers fall so that we can contact every new case. We will start when we have the system up and operational, and we will increase the number of people who are involved in contact tracing. And as we gain experience, we'll have a better idea of the percentage of people we identify who are willing to participate in contact investigation. I think what we have found so far is that most people, because contact tracing has been going on, many of our local health departments have done contact tracing throughout the pandemic so far. Many people are interested in, when they discover that they're infected, to make sure that they self-isolate at home. And there has been contact tracing going on, identifying contacts and asking them to stay at home. I think the vast majority of people are interested in taking those measures and protecting their family and their friends and their community. Not everyone can self-isolate or self-quarantine at home. And these are some of the things that this Reopen Connecticut Advisory Group are looking at in terms of how to provide alternative places where some people can go to recover if they're infected or if they need to quarantine and they can't do that at home. These are called wraparound services and will be part of the contact tracing initiative.
And Dr. Carter, one thing to add to that is that with our new contact system, we are using SMS text technology as well as emails to help automate some of this work. So as opposed to traditional contact tracing where somebody would have to pick up the phone and speak to every individual, we're still having that option for people who are more comfortable talking to a real live person. But for individuals that are comfortable receiving text or an email, that will help to increase the load of people that we can follow at a given time.
One of the health directors I spoke to recently about contact tracing said rapid testing will be a key to this working well, for the simple reason that if you get test results 3 days after somebody's exposure, they have 3 days of exposing other people. So what is the assumption in your model as to A, will rapid testing be available late May, and B, how crucial that be doing a job of contact tracing?
Yes, it is expected that the number of tests available in Connecticut will dramatically increase over the next month. And it's also expected that the turnaround time will be much quicker. I know that just 3 or 4 weeks ago, we were talking about 7 or 8 days, but now it's more like 2 to 3 days, even at the commercial laboratories. What we're really looking for is testing that can be available within, test results that can be available within 24 hours. That's the current goal for the next month. And part of that will be using sort of different methodologies to try to get samples sent in. It'll involve increasing the number of testing places and moving those specimens quickly to the laboratories that we'll be working with in the ramp up to increase testing. But we agree, shortening the length of time will be really critical, because if we can shorten the time between the test result coming in and the person being contacted, it makes contact tracing and investigation much more effective.
And final question, when you talked about starting testing on asymptomatic people, how will they been chosen? Will these be people that your contact tracing has shown to have been exposed? Is that how asymptomatic people will be asked to undergo a test?
Well, I think that will be how it starts, is to offer that to people who are contacts of known cases. But I think what's envisioned, and I've been hearing about what's planned in other states as well, is that once testing is much more widely available, people will be able to go to a community testing site, as they do now, whether it's the CVS drive up or to the hospital, whether they are symptomatic or not. We haven't, it's no longer a requirement that you have symptoms of COVID in order to be tested. That went away a long time ago, and we are already testing people who are asymptomatic.
But to clarify and build on that, as part of the testing strategy that we're developing, we will have some prioritization, in particular for frontline workers, healthcare workers, others in nursing home workers, others in particular high-risk environments that could be sources of rebound infections. So there will be some structure around that as well.
Thank you.
NBC Connecticut. Move along next to the Hartford Courant.
Thanks, Max. Dr. Carter, Connecticut has the third highest death rate for COVID in the country, as far as we're told. Can you tell us what are the biggest factors why Connecticut has such a high death rate?
Yes, and it may be for a reason that you may not be aware of. Connecticut is one of the states where we count not only confirmed, laboratory confirmed COVID-19 associated deaths, but we also include probable COVID-19 associated deaths. That second category are people who die, who have been exposed, for example, in a long-term care facility, who have symptoms suggestive of COVID-19 but have never been tested. And the Office of the Chief Medical Examiner, after an investigation, will decide that those cases were probable. Many of the states, including states around us, do not count probable cases of probable deaths due to COVID-19, and are only reporting out confirmed cases, confirmed deaths, laboratory confirmed deaths. So in part, I don't want anyone to misunderstand. Connecticut, New York, greater New York City metro area, parts of New Jersey, Boston, Providence, we're all seeing levels of COVID activity that many parts of the country are not experiencing. But in terms of Connecticut, we are counting both confirmed, laboratory confirmed deaths and probable deaths, which some of our neighboring states are not.
Okay. Also, Governor Cuomo said yesterday that he had wished that he had acted sooner to control the pandemic. Is there anything that you feel that there are moves that you could have made sooner in the same way that Governor Cuomo is talking about?
I think in hindsight, everybody wishes we had done everything sooner, including ordering all the PPE, ventilators, and testing gear. You know, that said, we were very soon, in part because we went at about the same time as places like New York and New Jersey. They were 10 days ahead of us, Chris, in terms of the pandemic. So that means we were 10 days earlier in terms of the preventive measures we put in place. And as Dr. Carter said, that made a big difference for us.
Thank you.
The Associated Press.
Good afternoon, everyone. Dr. Carter, you were talking about we have to dramatically increase testing. What type of numbers are we talking about in terms of dramatically increasing, and what is the right amount of testing for our population? And can you give us sort of like some benchmarks of dates of when we might see this ramp up?
I'd be happy to give you a sense for what's going on. This is actually the topic of one of the subgroups of the Reopen Connecticut Advisory Group. I'm actually provide technical assistance to that group, so I'm aware of the discussions. And one of the things that I've been increasingly aware of over the past couple weeks is how many sort of different recommendations there are that have surfaced nationally about how many tests we should do in order to feel comfortable with reopening the state. I don't think anybody knows exactly that number should be. One of the suggestions that was raised a couple days ago was everyone in the United States should be tested every 2 weeks, which is an extraordinarily high number of tests that would be required, and it would take us quite a while to get there. Right now in Connecticut, we're doing about 4,000 tests a week, and we need to ramp it up much more than that if we're going to be able to successfully do contact investigations. And so I can tell you that right now, one of the benchmarks, the first one that we're talking about is trying to increase the number of tests by the end of May to somewhere around 50,000 tests per week, which would be a dramatic expansion compared to where we are right now. And then there are other benchmarks further out. And as Josh mentioned earlier, there's also a strategy that talks about these are the people that need to be tested if we have this many tests per week. These are the groups that we will expand to if we have more. These are the groups that we will expand to if we have more than that. So we're trying to develop a flexible framework. Part of the issue with testing is actually the laboratory testing capacity is increasing faster than the capacity to actually get samples. There's a national shortage of swabs right now, for example, and actually that's limiting some of the testing that we're able to get done, is that we can't get the samples that are needed to take to the laboratories to be tested. So there are all these supply chain issues which need to be considered as we move forward.
Yeah, so let me just add to what Dr. Carter said so well. We are ramping up our testing as quickly as we can. And that's the beauty of the relationship with Abbott and CVS and Quest. And by ramping it up, we want to accomplish two things. As Paz was talking about previously, speed up the turnaround time on that. Obviously, the Abbott lab test is nice because that gets us, a 15-minute turnaround. But even Quest Diagnostics, because we're using their lab just across the border in Massachusetts, is giving us results in less than 24 hours. And in terms of track and trace, if we can notice those people sooner and get them tested sooner, we can stop the virus sooner. That would have been incredibly valuable 6 weeks ago in the nursing homes to have that faster turnaround. And in terms of opening up the lens on who we test, as Josh said, obviously we're focused on frontline workers, focused on nurses and doctors, folks that are infected or folks who are at the ICU, so we know how to triage them. But if we expand that base in terms of food service workers, other frontline workers, factory workers going into EB, people that live in very congested areas where the virus is more likely to be contagious, there we have the opportunity to do symptomatic and asymptomatic testing, and that will tamp down the spread of this virus in a dramatic way.
And thank you for that. And Governor, when you talked about the contact tracing, you said that you were in conversations with Governor Cuomo. Is this initiative that you're talking about today, is this the same thing that he was talking about in terms of working with Connecticut and New Jersey? Because he had mentioned former Mayor Bloomberg's foundation. And are they going to be working with Microsoft as well?
Look, we're going to do this the Connecticut way. We're off to a fast start. I do talk to Governor Cuomo, and thanks to his good work, the Bloomberg Philanthropies is looking at their technology platform. They're going to be providing a training mechanism for contact tracers. Connecticut will be able to be part of that. And obviously, look, when we trace people and they were in Danbury, but then they went down to Westchester, we're going to have a shared way that we can find out who was back and forth so we can protect each other. Again, the Westchester, Connecticut border is no border as far as the virus is concerned.
So these two state systems are going to talk to each other then?
They'll be able to talk to each other.
Thank you very much.
Thank you.
Move along next to Fox 61.
Zania Malgado, Fox 61. Actually, Governor, you just answered my first question talking about how you guys are going to be working with New York for contact tracing. Could you also talk about maybe how you're going to be working with other close states like Massachusetts and Rhode Island? Will the Department of Public Health be reaching out to, say, individuals who live in other states besides Connecticut that could have potentially gotten COVID?
Well, Paul, you're our ambassador to these other states.
Yeah, I'll take one part and I'll pass it off to Dr. Carter as well, the work he does with the other public health departments. So the collaboration that the governor spoke about with the Bloomberg Philanthropies in terms of the collaboration in terms of this process is all because of the fact that the governor led a regional initiative and understood that this virus, as he stated, has no borders. So I have daily conversations with my counterparts in every other state where we pass off what we're doing, how we're doing it, so we can make sure that our systems talk to each other. And then, of course, on the agency level, I'll pass off to Dr. Carter to talk about the work that he does with his public health officials from across the state, across the region.
And yes, communication between us and our neighboring states continues as it has been. We're always, we know each other really closely, Massachusetts, Rhode Island, New York, New Jersey. We've worked together at the state level for years, and we actually have a means to communicate about cases and about contacts. Up until now, it's largely been over the phone, but even though we probably will not have the same technological systems, New York should probably choose one that's different. Massachusetts has already chosen a different system. Rhode Island has their own system, which they've set up, which is separate from Massachusetts. New Jersey has not yet selected a system, I don't think. But what we'll be able to do is to share electronic files so that can be imported into each other's systems that would contain information related to residents of those states. Obviously, if we learn about contacts in Massachusetts, we'll be sharing that information with the Massachusetts State Health Department. And that's the way it would also work for Rhode Island and New York and New Jersey.
And then we received a question from a viewer, Governor. It reads, I'm working 2 jobs and risk catching the virus to care for my patients, while individuals who are unemployed and staying safe at home are getting an extra $600 added to unemployment. Will essential workers also get compensated? So, Governor, what's your message to some of these essential workers that know what they're doing is important, but also feel like they're getting the short end of the stick?
Well, I'd say the unemployed envy the people who are working. They wish they had their job back. We're doing everything we can to get them their job back. Look, for the essential workers, we're doing everything we can. Obviously, in the nursing homes, they're getting some combat pay. If you're working at a hospital, we got daycare. If you're at a food service, at Stop and Shop, we're providing subsidies for your daycare going forward. If you're a nurse, we've got life insurance policies. So we're doing everything we can to remind those frontline workers every day how much we appreciate what they're doing. And those folks who are at home, salute what those frontline workers are doing for them as well.
The Day of New London.
Hi, the first question is for the governor. Do you think the federal government should provide funding to either employ or hire contract tracers, also to provide resources to help infected and exposed people stay isolated, like money for hotel stays or compensation for lost wages?
The federal government has actually been pretty good at this. I mean, they are reimbursing us for our COVID-related expenses. We're going to have to figure out in terms of track and trace and testing what those expenses look like and see whether we're getting enough. But I would argue that that's a place where the federal government has stood up and been an effective partner for us.
Okay, and my other question is, with the various states looking at reopening, I mean, maybe this is a question for Paul, like with Rhode Island looking at opening at a different date than Connecticut and New York, how is that being factored into sort of the reopen plan here, given that people and traffic can flow across state lines?
You were breaking up a little bit there, but I think I got the gist of it. What we've been doing on the regional level is it's about constant coordination, constant communication, and understanding the decisions that are happening in each individual state and understanding how it affects the other state. We were well made aware of some decisions that were made in Massachusetts and Rhode Island as it deals with schools, and we calculate that as part of our reopen strategy. Similarly, understanding that New York is going to be making the decisions and gradual reopening, and they're applying construction. That is calculated. Similarly, as what we have done in terms of keeping various elements of our society and our economies open, other states are calculating it. Those calculations wouldn't be done by those other states or by us if we were not talking. And I think that's the importance of what I think I've been harping on, the great work of the governor, of it's important that we have strong collaborations with our regional partners during this public health epidemic. We might be states, but we do not have borders when it comes to public health epidemics. And so that's the strong part that we are consistently focusing on. I'm on constant conversations. I do too many conference calls, but they're conference calls that are important and necessary for the decisions to be made on behalf of the public health of the people of Connecticut.
A couple of examples. Obviously, we did bars and restaurants at the same time just so we didn't incent people to cross back and forth across the border. You know, we left our marinas open. New York closed them. That didn't work, so now they have opened, so nobody has an incentive to go back and forth. We didn't close our parks and beaches, and Rhode Island had. Now they'll be opening them, just so, again, there's less incentive to go back and forth. This collaboration works for us both.
Thank you.
Thank you.
News 12 Connecticut.
Hi, Governor. Since Paul and Josh are there, I wanted to follow up with a question that we asked last week. You extended rental relief to residential tenants, and especially the grace period if people can prove a hardship. We keep hearing from small businesses who are commercial tenants saying that their landlords are not cutting them any slack. There's being said, they're telling their tenants, we don't have to because the state didn't order us to. Is there any thought about extending that order to commercial landlords?
Either of you want that?
It is something we've been looking at. As the governor said previously, we're really counting on commercial landlords who are getting a number of benefits if they have mortgages and so forth to be able to pass those benefits through. You know, this is a public health emergency, and so the focus on the residential side was to ensure that people weren't getting evicted and creating a public health additional risk by, you know, being out on the street. But it is something that we're constantly looking at, and if it becomes a problem, we'll find a way to deal with it.
Correct.
move along next to News 8.
Thanks. I had a question on the issue of testing. And yesterday, the state had changed its reporting from people tested to total tests done. My understanding was this was done to, in part at least, align with CDC standards on this. But I'm wondering if anyone could just talk a bit more about why that change was made and if it might have any impacts on federal resources we could get or assessments of work that's been done in the state so far.
Yeah, we decided to...
Oh, go ahead, Josh.
I'm sorry, just quickly. So we decided to make that change because we're now at a phase in this where many people are being tested for the second or third time. And so by making this change, it becomes a more accurate reflection of our actual daily testing volume in the state of Connecticut.
And one more question, just going back to the issue of testing and contact tracing. Is there a baseline percentage of positive tests that we would need to ensure that the time and energy we are spending on contact tracing isn't, fruitless isn't the right word, but is as effective as we want it to be? Because it seems like maybe we don't know what that number is. So if we don't, maybe can we just talk a bit about why it is a hard thing to pin that down?
If I understand your question correct, there's a lot of discussion among states and other public health professionals about what level of percent positive do you want to see. Many of you may remember at the beginning of the pandemic, which seems like a long time ago, all the testing was done at the state public health laboratory. And initially, we started at 5% of all the tests were positive. And then it went to 10, and then to 15, and then to 20. And in our long-term care facilities, many of our long-term care facilities have had 50% of the people tested their test positive. 50% is way too high. And I think the target is to make sure that we want to get around 30% positivity would be the best measure to essentially calibrate the testing with the contact tracing.
Look, I want to thank Kristen and Dr. Carter for being with us today and explain the testing and the track and trace in a serious way. I think you know what we're trying to do to get this state open as safely as we can. Just wanted to leave you with a conversation I had this afternoon with Ambassador Wang Ping. He is the Consul General, and he's been the person that we've been working with as we try and get PPE out of China over here to Connecticut. And obviously there's some trade issues and the such, and he's been very helpful for us. And a lot of gear has come in. He announced that Shandong Province wanted to say thank you and give us additional N95 and surgical masks. And I asked about Shandong Province. Of course, I told him it was one of my favorite provinces. And he said, yes, this is the sister province to Connecticut. You are affiliated closely. And I said, of course. And tell me about Shandong Province. And he said, Shandong Province is not that big a province in China, but it's very prosperous, next to South Korea, closer to Japan. And it's got over 100 million people for a small province, so it's fairly dense, as is the state of Connecticut. He went on to say that it's a source of great pride, Shandong Province, in China, because that's where Premier Xi's wife is from, so that's a big deal. And a big deal to me was that was also where the Confucian heritage came from. So we have a pretty good sister province in China, and I really appreciate the gear that they've given us and working with you, Consul General, to get this done. Thanks, everybody.